Friends, today we are going to discuss about something called masked treatment. It seems to be a new treatment. We haven't heard about it, but the fact is that it is not a new. It is a very commonly available treatment, commonly followed treatment, and for the lifestyle diseases like thyroid, cholesterol, diabetes, etc. Many of the people they follow this masked treatment. The reason of discussing this treatment here is it is not the right treatment. It is a very dangerous treatment. As the very name shows, masked treatment means the treatment which comes with a mask, which comes with a cover, which comes with a veil, which comes with a partition, which makes the other side invisible is called masked treatment. If you take this treatment for the lifestyle diseases, then you will remain under the impression that you are getting cured of your problem, because the investigation reports, the blood test reports, etc., it will show a very normal figure which used to be abnormal before this treatment, and it makes you happy. My reports are good, but the symptoms what you were having because of this disease earlier, symptoms will remain same. You will keep on suffering from those symptoms in a same way, even in a worse way during this masked treatment. But the reports will be showing you good results. So it will mask the disease condition. So it is nothing but the deceiving of the patients. In the medical professional, if you deceive the patients, then that is not a good thing. Every doctor cannot cure 100% of the cases, but when the doctor puts the highest effort, then that gives much relief even to the patient as well as to the doctor that I have given the best effort. So the main cause behind the masked treatment is the intention of the doctors who wants to keep the patient in the dark instead of telling him the truth, whether this treatment is taking them to the cure or it is just masking their disease. Today I'll tell you regarding these three diseases, thyroid, diabetes and cholesterol, what common people do and how they remain in the dark. What are the symptoms of thyroid? Abnormal weight gain, abnormal menstrual cycle, abnormal hair distribution. In case of women, the facial hair growth, like the beard comes. In case of women, the mustache comes, excessive facial hair. Then palpitation, fear, anxiety without any reason. That is, these are the symptoms of abnormal thyroid. If we get these symptoms, then we can suspect thyroid. So in order to diagnose, we advise the patient to undergo the blood test for thyroid profile. There we see T3, T4 and TSH. TSH is the thyroid stimulating hormone, which is the yardstick to diagnose the thyroid abnormality. So if the TSH comes lesser, then TSH comes higher than the normal range, higher than the normal range, then it is called hypothyroidism. If the TSH comes higher than the normal range, it is called hypothyroidism, because in your body the thyroid hormone is less. Hence, the thyroid stimulating hormone is more in order to synthesize more thyroxine, thyroid hormone. Now, fine, we have diagnosed the disease. What about the treatment? In the modern system of medicine, if you go for thyroid treatment, then that is a lifelong treatment. As long as you keep on taking, it will give you good result. And what kind of good result I will tell you just now. And once you leave this medication, again you are back to the 0 point. Why is it so? Because in modern medicine, it has the facility of giving supplementary treatment. Means what? It will keep on supplying the deficiency. In your body, when thyroid hormone is less, so the doctor advises you to take thyroid medicine every day. Thyronorm or whatever the medications available, every day morning you have to take. So what is that, doctor, you are giving? That is a thyroid hormone medicine which we are supplementing from outside, because in your body the secretion of thyroid hormone is less. Now the patient can ask to the doctor, if the secretion is less, what is the way to improve that secretion? If you keep on supplying the thyroid tablet every morning, will one day automatically our body will start secreting, synthesizing more thyroid hormone? Never. That can never happen, because the thyroid hormone is less. There is a reason behind this. That is, the thyroid gland, it has become dysfunctional. Why there is a defect in the thyroid gland? Because there is another gland called hypothalamus in the brain, which stimulates the thyroid gland to secrete thyroxine or thyroid hormones. So there is a defect in the hypothalamus. Again, the cause of that, why hypothalamus is defective? There is another gland called anterior pituitary in the brain. That anterior pituitary is responsible for stimulating this hypothalamus, which again in response stimulates thyroid gland. So you see, there are three staged stimulations after which the thyroid gland synthesizes the thyroid hormone. Instead of going to correct all these three staged mechanisms, if I tell you just you keep taking the thyroid tablet every morning, will you get cure anytime? Any layman can say, no, it cannot happen. Now, the people who are undergoing this thyroid treatment, taking modern medicine for a long time, each time they test, the blood report comes satisfactory. Why? Because in your blood, we have checked earlier, the thyroid hormone was less. So we kept on feeding you thyroid tablets. Now, when we check in blood, the report is showing normal thyroid hormone. So it is just kidding, isn't it? And doctor says you are much healthier now. Your reports are good. Patient is happy, doctor is happy. But dear friend, if you are listening to this video, make sure that you understand the fact behind. That report, what it has been shown to you, that report is nothing but the masking of your disease. The disease in reality is remaining inside you. The dysfunctional condition of this thyroid gland is maintained there. Only the blood report is showing a different result, because that is being manipulated by everyday supply of the medication. Number 1 point. Number 2 point, thyroid abnormality, if you have, it cannot show simply in the blood. As I told you in the beginning, you have symptoms. All these symptoms will be there. Abnormal weight gain, abnormal menstrual cycle, hair distribution, all that will be there. Any patient who is taking modern medicine for thyroid ailment, and whose blood report is showing normal figure, have you ever seen that there is any improvement in any of these symptoms? Clearly, I'll say no. You may keep on taking thyroid tablets throughout your life, but the associated symptoms, the abnormal weight gain, abnormal menstrual cycle, abnormal hair distribution, palpitation, anxiety, irritability, that remains as it is in the same position. Now you can ask doctor, if my blood report is showing normal figures, then what about my symptoms? Why those symptoms are showing no change, doctor? Probably doctor will have no answer to give you because you are under the masked treatment. So ask yourself, where is the cure? Where is the cure then? It is only the masking of the disease. Come to the other point, cholesterol. We all know in our blood level, if our cholesterol level is more, then it is called we have increased cholesterol level. Why there is increased cholesterol? Because our liver is producing more cholesterol in some cases, so we get more cholesterol in our body. What are the associated symptoms? You will get abnormal appetite, flatulency, decreased appetite, indigestion, constipation, hard stool, mouth odor, fatigue, coated tongue, chest burn, acidity, burping, bloated abdomen, all that are the parts of increased cholesterol. How we diagnose it? When we take the blood test, we get it. If it is above the normal range, it is increased cholesterol. Now, mainstream medication, when you go for this cholesterol problem, they offer the very popular medicines called statins. You can see my earlier videos on statins elaborately. I have worked on that. Why statins really do not work. Now, when you take statins, in a nutshell, I will explain you how it works. So what happens here, what the doctor do? Statins he prescribe. Now, your liver is at fault. It is producing more cholesterol, but we cannot control the liver. We cannot take a part of the liver out, or we cannot cut the liver, or we cannot make the liver shrunk. Then what to do? We don't have any hold on the liver. Then what to do? So in modern system, we have found another tricky way to control cholesterol. What is that? There is an enzyme that stimulates to produce cholesterol. So we can give you medicine which will stop that enzyme secretion itself, so that there will not be any stimulation of liver to produce cholesterol. So the cholesterol production is totally stopped. With an example, we can understand. If in our company or in our organization, we have found one of our employees is making more expenditures, spending more money. So what we can do? Straight away, we will stop giving him salary. Instead of advising him to stop this extra expenditure and make proper money management, we will stop his salary totally. We will not give him his remuneration. Now you tell, inside the family, if one member is earning, then how many other members would be relying upon that salary? And what about those other members' life? This person who has been doing more expenditure, he must be doing also necessary expenditures. What about those necessary expenditure? How he will manage that? Because he has no more income. So blindly you can say this is not the correct procedure to stop his remuneration. The same concept is applicable here. If you stop completely the production of cholesterol, You know what all devastation will happen inside your body? Cholesterol is very, very important for our body. Even the cell structure, cell membrane development needs cholesterol. For secreting bile acid, which is helpful for digestion, we need cholesterol. If we stop producing cholesterol, the digestion will get affected because the bile acid secretion will be less. Various hormones, estrogen, progesterone in case of women and testosterone in case of men. Adrenal hormone, that is a stress combating hormone in our body, that also needs cholesterol. If you stop, then how you will combat the stress in your daily life? If calcium metabolism happens in your body, now for the calcium metabolism you need vitamin D. Vitamin D, how you will get it? You will get it with the help of cholesterol. To produce vitamin D, we need cholesterol. So I have seen people with lesser vitamin D and calcium, they are being asked by the doctors to drink milk enough. But how can it be? Drinking milk makes the calcium to go inside the body, but how the calcium will get metabolized? You should have enough vitamin D. How enough vitamin D you will get? You have stopped the production of cholesterol. Do you know that 25% of our cholesterol in the body is found in our brain alone? So cholesterol is so important for us. If there is no cholesterol, you will get fatigue, muscle weakness, the skeletal muscles will become weak, and the damaged muscles, they will release the proteins into the blood, which will again collect in the kidneys. So finally, kidneys will get damaged when it tries to eliminate this amount of proteins. Though, so you get kidney failure ultimately if you are under the statins for a prolonged time period. But unfortunately, when such patients they develop this kidney failure, no doctor tells that it has happened because of your prolonged intake of cholesterol medicine. So now it is clear that cholesterol is required for our body. So we cannot absolutely stop its production by taking anti-cholesterol modern medications. First point is clear. Now second point is, if we take this medicine, modern medicine for cholesterol, the statins, etc., do we find change in our other associated symptoms like flatulency, indigestion, acidity, fatigue, mouth odor, bloating of stomach, indigestion? Do we find any change in those symptoms? No, we never find. So now if you go to the doctor, doctor, you have given me medicine to decrease cholesterol, then why I'm not getting relief in my associated symptoms? Doctor will be speechless because he has no answer to give you. If you say I have indigestion, he will give some gelutia like of syrups again. Acidity means he will give you pan 40 like tablets again. But do you think it is advisable to take medicine, one medicine for acidity, one medicine for flatulency, one medicine for cholesterol, all that from different directions? No, not at all, because these things will lead you nowhere to cure. You are going in the opposite direction of cure. So, where is the cure? That will be the cure where you can make the liver automatically to produce the normal quantity of cholesterol. So they do not mask your disease. People say under homeopathy, since 6 months we have taken treatment, 1 year we have taken treatment, but no satisfactory result we are seeing. The cholesterol levels are not coming down satisfactory. What to do now? Should we switch over to allopathy? Then we say, you are going, now you are in a bad position, no doubt, but if you are taking modern medicine for such complaints, then you will be going to the worse system. Because now at least it is transparent that you are able to know this is the disease position. But once you take the masked treatment, your disease will remain masked. In the report, you will see good numbers, good levels, but within you will go on suffering more. So which one is more dangerous? Having the disease now in this stage or in the masked stage? Same concept is applicable for the diabetes treatment. What is diabetes? It is the increased blood sugar level. Here, only the sugar metabolism is not affected, rather it is the metabolism of fat, carbohydrate, protein, everything is affected. So it is having multiple facets. You can suspect diabetes if you have increased thirst, increased desire to eat carbohydrate, increased urination, unnecessary too much of fatigue, tiredness, all that. What is the cause? Why it happens? It is found that the pancreas stops producing insulin. That is why the sugar metabolism gets affected. So in modern system therapy, the patient is being given insulin either in the form of tablet or injection from outside, just like everyday doses of statins or everyday doses of thyroid, you are being given the everyday doses of insulin. So does this insulin intake every day will make you one day, will make your pancreas to secrete insulin more? No, never. However number of months you keep taking, injecting insulin, but in this process, you can never expect that one day my pancreas automatically will be enabled to produce insulin or synthesize insulin. So, is it the cure? No, it is not at all. Not only that, not only that the disease gets masked here, but also you can see the harmful chemicals which is there in the modern medical system, modern medicine. If you keep on taking those tablets every day, then lot of side effects come, because ultimately these are the toxins. Ultimately these will come to the blood. Ultimately this will come to the kidney to get excreted. So this brings n number of side effects. The people who are taking modern medicine for cholesterol, definitely most of them lead to cardiac disease very shortly or later. It is a myth that if you keep your cholesterol under control by taking statins, that your heart will remain protected. Never, because the symptoms are there. The cure only then will come when the symptoms are relieved. Secondary is the blood report. People with hormonal imbalance, when they get the blood test done, they bring the report and report is showing a better level. They become happy that I am getting cured. So we educate them that the report is not the final yardstick to tell you that you are diseased or you are healthy. Rather, your feelings, your symptoms, your expressions of the disease in your body, these are the important yardstick to tell you that whether you are healthy or not. If you find this information useful, Do not hesitate to subscribe here so that the further videos on such important information can be reached to you in the earliest. For more, log on to my website www.drmeeta.com. Thank you.